Bismillahirrahmanirrahim. Assalamu alaikum dear viewers. I am Dr. Muhammad Usman, and in today's video we will discuss the factors which cause resistance to the airflow in the airways. So as you can see, this is our respiratory tract or the airways, and it has been divided into two major portions, that is upper respiratory tract and lower respiratory tract. The upper extends from the nose up to the level of larynx, while the lower starts from the trachea and goes up to the level of alveoli. So the lower respiratory tract, starting from the trachea, it divides into two primary bronchi, which further divide to form smaller secondary bronchi, which further divide to form tertiary bronchi, and so on. It divides again and again and again to form smaller and smaller bronchi, and it has been estimated that till the time alveoli reach, the respiratory tract has divided almost 24 times. So if you ask you a question that what do you think, in which portion of this lower respiratory tract the resistance to the airflow will be highest, probably your answer will be that in the smallest portions of this tract, in the smallest bronchioles. But actually it is not the case. It is the trachea and the initial bronchi where the resistance to the airflow is highest, and it is because the trachea is a single structure, okay, and it has got less cross sectional area. All the air which is going to the alveoli or coming from the alveoli, it has to pass through this single structure. So and it has got less cross sectional area, as I already told you. So this is the reason that trachea it offers 90% of the resistance to the airflow. And if we talk about bronchioles and bronchi, then again there is a surprise for you. So this graph shows on the x-axis there are number of divisions of the respiratory tract, and on the y-axis resistance to the airflow. So this side almost shows the level of large size bronchi, this shows medium size bronchi, and almost this side shows the level of smallest bronchioles. And you might have observed that the highest resistance to airflow is offered by not by the smallest bronchioles, but it is offered by the medium sized bronchioles, and it is because the medium sized bronchioles, they are less in number, okay, they are less in number, while the smallest bronchioles, they are almost 65,000 in number, and they are arranged in a parallel circuit. And we know that in parallel circuit the total resistance is less than all the individual resistances, okay. So this is the reason that the highest resistance is not offered by the these smallest bronchioles, but it is offered by the medium sized bronchioles. Now having said this, the smallest bronchioles, they do offer great resistance in certain pathological conditions like edema, like in mucus collection, or if there is smooth muscle contraction in their walls. Now let us discuss various factors which determine the resistance of airways. The most important factor which determines the resistance of the airways is airway radius. As you can see here, this is the normal radius of the airway. Then in asthmatic patients the radius is reduced, and here it is further reduced. Now according to the Poiseuille's law, the resistance is equal to 8 eta L divided by pi constant radius raised to power 4, and it tells us that resistance is inversely proportional to radius raised to power 4. So it means smaller is the radius, more will be the resistance. Just to give you an example, if the radius of a bronchiole, it is half than the normal, okay, radius of a bronchiole is half than the normal, then its resistance to air will not become double or triple or 4 times, it will become 16 times according to this equation. So radius has got so much importance in determining the resistance to the airflow. Now, I have a brainstorming question which is interesting, that why is it somewhat more difficult to breathe in a steam filled washroom, and the hint is Poiseuille's law. You can give your answer in the comment box, please. Now, the next factor is the length of the airway, and from the Poiseuille's law you might be expecting that larger is the or more is the length of the airway, more will be the resistance, and it is true. But length of the airway is not an important factor in determining the resistance of airways, and it is because the length of airway does not change much during phases of the respiration and in normal respiration and even in diseased conditions. So, this is a less important factor. Now, type of airflow, it is a very important factor. There are two types of airflow, that is laminar or smooth or streamline flow, which is seen in normal quiet breathing, and turbulent airflow, which is seen during exercise or in rapid respiration. Now, this turbulent airflow offers much resistance to the airflow, and the tendency towards turbulence, it can be determined from a number which is called Reynolds number. Now, this is the equation which shows us Reynolds number, and according to this equation, Reynolds number Re is equal to V d rho over eta, where V is the velocity of the airflow, d is the density of air, d is the diameter of the airway, rho is the density of the air, and eta is viscosity. So, from this equation we can conclude that Reynolds number will increase when there is increase in the velocity of airflow or density of the air or diameter of the bronchi, and more is the Reynolds number, more will be the chances of turbulence. Now, the next factor is also important, and it is autonomic nervous system, and you know there are two divisions of the autonomic nervous system, that is sympathetic and parasympathetic. Now, sympathetic stimulation causes bronchodilation and increase in the diameter of the airways. So, sympathetic stimulation decreases airway resistance. On the other hand, parasympathetic stimulation, it causes bronchoconstriction and decrease in the diameter of the bronchi and bronchioles. So, parasympathetic stimulation causes more airway resistance. The next factor which determines the resistance of airways is phase of the respiration. Now, during inspiration, because the lungs expand and the airways also expand, so there is less resistance to the airflow. But during expiration, there is tendency for the airways to collapse. So, during expiration, resistance to the airflow is more, and this is the reason that asthmatics, they feel more problem during expiration. They can have normal inspiration, but they feel much more resistance and difficulty in expiring air because during expiration the diameter of the airways is reduced. Next factor is severe coughing, and we know that in coughing our airways, they constrict to increase the velocity of air to expel any object which has been lodged in the respiratory tract. So, this is the reason that during severe coughing the resistance to the airflow, it increases because the diameter of the airways is reduced as a result of their constriction. Next is the effect of bronchial tone. Okay. So, bronchial tone is basically a 24/7 state of the partial constriction of smooth muscles which are present in the walls of the bronchi and bronchioles. Okay. It is a state of partial constriction of smooth muscles in the bronchi and bronchioles, and this bronchial tone, it has got a circadian rhythms, okay, according to the 24-hour cycle. It is highest in the morning and it is lowest in the evening, and this is the reason that asthmatics which have constricted airways, they often feel more difficulty and they have often more frequent attacks in the morning than in the evening. Then there are some other factors which also cause resistance to the airflow, like histamine and slow reacting substance of anaphylaxis, which are released during allergic reactions and especially during pollen allergy. Then there is sulfur dioxide gas and dust and some of the acidic elements in smoke, which also increase the resistance to the airflow. And then if there is increased production of mucus or there is hypertrophy of the bronchiolar smooth muscle, then again there will be more resistance to the airflow in the airways. Hope you would have enjoyed today's short lecture about the resistance in the airways. If this is so, please consider subscribing to this channel, and happy learning to all of you. Stay blessed and Allah Hafiz.